The broadcast is now starting. All attendees are in listen-only mode.
Hi, everyone. Thank you for joining us. On behalf of my team at ODE here, we'd like to welcome you to a webinar and information session where we'll be talking about 504, Section 504, particularly as it relates to COVID-19 and distance education implications. I'd like to introduce our team. First, we have Winston Cornwall, who is our Civil Rights Education Specialist, and he'll be our primary presenter today. We also have Dr. Beth Wiggum on the call. She is our School Counseling Programs Education Specialist, as well as Marnie Jewell, who is an Education Specialist in the Office of Education, Innovation, and Improvement. My name is Grace Bullock, and I am the Mental Health Strategist and Policy Analyst at the Oregon Department of Education. So quickly, a little rundown on how we're going to do this today. First of all, thank you for being here. We really appreciate your time and your attention and your participation. We're going to start the session off with about a half an hour of information presented to you by Winston. And we encourage you during that time to put any questions that you have in the chat box, because we have a pretty large group today. Unfortunately, we're not going to be able to open it up to audio Q&A, but we will be, Dr. Wiggum is going to be facilitating reading the questions, and then we will respond to as many questions as we are able in the time that we have. The webinar and the slides will be posted on our website probably within a few days. So if there's anything that you missed or want to refer to, you can come back to the website. That would be the COVID-19 page on the Oregon Department of Education website under Mental Health and Social Supports. And there will be a special area as of Friday that is specifically dedicated to administrators, school counselors, and other mental health professionals. So with that said, I am going to turn it over to Winston. And again, thank you for joining us, and we'll see you at the chat.
Okay, thank you very much, Grace. Good morning, everyone. We really appreciate the turnout and your commitment to Oregon students, and spending some time with us talking about Section 504 COVID-19 and distance education implications. I also want to thank Grace, Beth, and Marnie for their leadership and persistence in making sure that we conducted this 504 webinar. They are among Oregon's Department of Education's elite analysts and specialists, and I feel privileged to be on the call with you today. I'm going to turn off my camera here and begin with a slides. I'm beginning with the end in mind. One of the things that I did is I've reviewed quite a bit of U.S. Department of Education Office for Civil Rights guidance on COVID-19 and students with disabilities, because this is what 504 information is. And these are the key points that appear to emerge from the guidance. The first and foremost, one of the foremost points is Section 504 is in full effect for Oregon's distance learning for all programs and offerings. This means that for school districts, if any school districts began on April 13th, which was the date that Governor Brown and Deputy Superintendent Gill said our distance for all learning for all programs had to begin, 504 plans are in full effect as of that date. Schools must ensure that 504 students have equal access to any program that's offered. More about this one later, but online education must ensure web accessibility for 504 students. And that's a responsibility of the 504 team to check in and make sure that students can access information if it's presented over the web. Telemental health and tele-integration strategies may be very appropriate for use, given capacity, ability, and availability. Here's a key point in the guidance. The Office for Civil Rights and the Oregon Department of Education understand fully that exceptional or extenuating circumstances may affect some of our service offerings or our ability to accommodate students. Lastly, 504 teams may have to decide if compensatory services are needed if adjustments can't be made to the effective service offering. Next slide is just a reminder of what Grace explained to us at the beginning. Our team is really interested in your feedback and questions. We're encouraging you to post the questions in the chat area. Be concise. We'll respond to as many questions as possible today, and we'll also create an FAQ area with additional responses soon. If you were to go to the U.S. Department of Education Office for Civil Rights webpage, and the easiest way to get to that is if you Google US DOE space OCR, the webpage pops up. If you open the webpage to the home page, and in the search box, just type in capital letters COVID-19, you'll see all of the information that OCR and the U.S. Department of Education have put up regarding distance education. Given our time and given the statements in the guidance, I reviewed the guidance, and I wanted to spend our time today focusing on 3 particular pieces of guidance along with the short webinar, because I think this gives us information that is useful to us right away. The first piece is a question and answer, a Q&A on providing services to children with disabilities during the COVID-19 pandemic. The second piece is a fact sheet. The initial fact sheet was pretty broad. It addressed the risk of COVID-19 in schools while protecting the civil rights of all students. So this looked at circumstances from pre-K to post-secondary, and it looked at all 6 of OCR's protected class responsibility. The key sheet for us in Section 504 and Title II of the ADA world is the supplemental fact sheet. What OCR does here is they still provide us information on addressing the risk of COVID-19, but they focus their attention on pre-K through 12 schools and students with disabilities or children with disabilities. Finally, they list a short webinar on online education and web accessibility. Here's some of the bullet points from the Q&A on providing services to students with disabilities. As we mentioned in the key points, whenever the school provides educational services to the general student population is when those services are also provided to 504 students. Excuse me. In the Q&A, it expressly says Section 504 students must receive a free and appropriate public education. When it indicates that indication that we must provide FAPE means that if we have a student on a 504 plan, we need to provide the plan accommodations and services as written. We have to remember if there are extenuating circumstances, we have to take some action to ensure that we can offer the service to the extent available and possible. The Q&A begins to talk about online options, online and virtual instruction, instructional telephone calls, or other curriculum-based instruction. Again, we're seeing this comment to the extent available. When we moved on to the fact sheet, remember, is talking about protecting the civil rights of all students. So 2 things that schools and districts must be aware is if schools receive any reports of protected class bullying or harassment that has occurred or occurs even in the distance education environment, it's something that we have to consider and respond to. Also, schools must not deny access to services based on race, color, or national origin. Examples of bullying and harassment that could occur related to COVID-19 included some reports of Asian and Pacific Islander students being taunted and being blamed for, we've heard terms used in the general media about the Chinese virus or the Wuhan virus. Some students, while schools were in session, began to look at Asian and Pacific Islander students and make accusations. That's an example of protected class harassment and bullying, and school districts have to respond to that. We need to be really clear, even though we're in the online setting, if something is said between students online and it's coming into or affecting the school environment, that's an area to which we must respond. The fact sheet begins to start to talk about the belief that compensatory services may be due to students if we're not able to provide the services in the 504 plan as written, or if the students do not receive the services after an extended period of time. One last bullet point that's in the fact sheet is it says that 504 students with high risks of severe medical complications that are excluded for school for more than 10 days may need an evaluation. So these particular students, and so they're generally thinking about students who may have tested positive for the virus. Their qualified medical provider has said that student needs to stay at home, not engage in schoolwork or any other activities other than getting well for a period of time. Once that exceeds 10 days, we're given clearance that the student can return to school. That student may need to be reevaluated for home instruction. Here's some information that came from this fact sheet that's specific to 504 teams and meetings. The first thing is the fact sheet clearly states that 504 teams do not have to meet in person while schools are closed. 504 teams can meet through telecommunication methodologies or through phone conferences. But remember, 504 is in full effect. So 504 evaluations will continue during this time period. If a 504 evaluation requires a face-to-face assessment or observation, the evaluation would need to be delayed until school reopens. However, evaluations or reevaluations that do not require face-to-face assessment or observation may take place while schools are closed, so long as the student's parent or legal guardian consents. I think this is very clear directives to us around what we should deal with regard to evaluations, reevaluations, and team meetings. There's some information in the guidance that says that the OCR and the Oregon Department of Education believes this as well, is there may be extenuating circumstances where it's really difficult to assemble the entire 504 team to act on a student's behalf. We have to weigh our ability to assemble our entire 504 team with the timeliness and effectiveness responsibility in providing the student accommodation. More about that a little bit later. The supplemental fact sheet is the one that provides quite a bit of detailed information and kind of does a deeper dive into what our 504 responsibilities would be. The information that's stated suggests that school systems must make local decisions taking into consideration the health, safety, and well-being of all students and staff. I think this is a real important statement because while the Federal Office for Civil Rights is providing us guidance, they're saying that the individuals who are driving 504 fate provisions right now are local school districts, school buildings, building coordinators, and 504 teams. a concern that I believe got raised was any thoughts that if we couldn't ensure 504 compliance, that some schools were considering not offering services or educational programs to students with disabilities. OCR this is the place they've been most definitive. If we need to ensure 504 compliance, that should not prevent any school from offering instructional programs through distance education. Federal law requires distance education to be acceptable to all students, and in particular 504 students, but it doesn't mandate specific methodologies. I'm sorry this next statement is pretty wordy, but I wanted you to see the near verbatim quote. If we use online technology or services, and that service offers a barrier to a student, and the barrier is based on the presentation of the educational materials are not available to the student in an accessible format, we essentially have to take some steps to make the information accessible. So an example of that might be if a teacher has a blind student in class, the student is working from home, and the teacher plans to distribute a document that is accessible to most students, but not accessible to the student who is blind or has a visual condition. The teacher can distribute the inaccessible document to the rest of the class, and if appropriate for the student who is blind or has a visual impairment, the teacher can read the document over the phone to that student or provide the student with an audio recording of a reading of the document aloud. Another option that may be offered is if the school has provided a laptop to the student may have a text-to-speech program installed in his or her computer to be able to access the information. Again, in the supplemental fact sheet, OCR emphasizes that 504 allows for flexibility in determining how to meet students' individual needs. So OCR is being really clear about saying that they want parents, teachers, and administrators to work creatively to make sure that we solve as many problems or issues for students that we possibly can. The supplemental fact sheet begins to expand some of the ways that we can provide distance instruction. They talk, this here is where we begin to see mention of telemental health and teleintervention services for staff meetings. They reinforce that meetings can be held on digital platforms. They talk about online options for data tracking and documentation. In communities where we need to use low-tech strategies due to the unavailability of internet access or web accessibility, those strategies might include an exchange of curriculum-based resources, instructional packets, projects, or written assignments. The supplemental sheet speaks to some services that they know can't be offered in the virtual or the distance learning environment. Examples of those might be physical or occupational therapy, or anything that needs to truly be provided face-to-face. The last document, and I won't take the time to show you this OCO webinar on online education and web accessibility, but this is the hot link to that. This is about, it's no longer than 8 minutes, I forget, I believe maybe 7 minutes and 54 seconds, but it's information on online education and web accessibility. There's some history behind this, and there's some action that the Federal Office for Civil Rights has taken nationwide around web accessibility. Approximately 5 years ago, local school districts and state education agencies began to receive complaints from the Federal Office for Civil Rights indicating that our websites were not accessible to persons with disabilities. The Oregon Department of Education is one of the state education agencies nationwide that received that complaint. So for the past 3.5 years, our agency, after entering into a resolution agreement with the Office for Civil Rights, has worked diligently to make sure that the ODE website is accessible and available to all persons. Because OCR has provided guidance, information, and has identified school districts who have had challenges providing web accessibility, I believe that this is perhaps our greatest concern because there's a history and OCR is really, I believe, in here saying this is something to which we alerted state educational agencies and local school districts for a particular time. We believe that individuals who are working online should be able to ensure access for students. And this is the place where they will probably hold us to the highest standard and have a little less flexibility. So I'm really encouraging you to review this online webinar and see how its information pertains to your school building or school district. With all of that in mind, I'm presenting some considerations for you all to see if you choose to implement. In the conversations I've had with building coordinators, many building 504 coordinators or case managers in Oregon or school counselors, we really appreciate your leadership and your actions on behalf of your students. But one of the things based on the guidance that we've seen from OCR is we need to begin to assess, in my professional opinion, we need to begin to assess when, what extent 504 plans are being implemented by our district staff or our building staff. I think this prompts 3 questions. So the first question we need to know, and so my hope is that either the building 504 coordinator or the district 504 coordinator's designee considers checking in with building staff and district staff that provide 504 accommodations and related services. And we need to determine 3 things. The first is which services or accommodations are being provided as written. The second is which services are not being able to be provided unless we make an adjustment or an alteration. And the third is which services cannot be provided in the current distance education setting and really must be provided face-to-face. Once we have an understanding of where we stand with certain circumstances, I think we're in a position to better respond, and we're in a position to, in effect, follow through with what OCR has recommended, which is basically, if we can implement the plan, implement the plan. If we need to make adjustments or alterations or modifications to certain items in the plan to provide services, we should consider doing that, maybe identifying that we're doing that in the distance learning environment. If there are services that we cannot provide in this environment, then when we return to face-to-face instruction, we need to assemble a team, assess the student, and determine if compensatory services are needed for that student. We need to do this in a timely and effective manner. So I'm asking you to consider something else that's a little bit different than our norm. Ideally, when we go through this process, especially for questions 2 and 3, we would assemble our entire 504 team. A challenge that we have in Oregon is we have between 5 and 7 weeks of school remaining for our Oregon schools. So we need to be prompt, timely, and effective. If we're able to organize our 504 teams, that should be our first call or first strategic move, because that's consistent with our policy. If we are unable to organize our 504 team in a timely, effective manner due to extenuating circumstances, the building coordinator and staff member who's providing the service or accommodation should consider recording the adjustments or ultimate alterations that are being made to the existing 504 plan and communicating this with the parent or legal guardian to get their buy-in, support, and input. Lastly, if we're unable to offer services in the distance education environment, it's a priority when we return to the school building for the entire 504 team to consider reevaluating students to determine if compensatory services are needed. Again, the focus being on actions being completed in a timely and effective manner. Our team today really wants to hear your feedback and questions. We'll make sure that we do our best to answer 504 specific and mental health related questions. We're very interested in focusing on support that you need for your students and their families, and guidance that you need to help support you and your colleagues in our work. So with that, I'm gonna thank you for your patience and understanding. And I believe I'm turning things over to Beth, who will begin to facilitate our Q&A session.
Thank you, Winston. Can you hear me okay?
Yes.
Great. Grace, it looks like you're muted.
Thank you, Beth. Thank you, Winston, and thank you all for listening. We're still working out this technology, as I'm sure many of you are noticing, and I wanted to just make note that for those of you that are having any difficulty hearing or seeing the presentation, this is being recorded, and we will be posting it on ODE's COVID-19 website in the mental health and social supports area. That is now being divided, so there's going to be a dedicated area for administrators, school counselors, and other mental health professionals, and there will be a resource tab there that will contain all of the webinars and all the slides from these presentations. So apologies to all of those of you that are having any technical issues, and we will definitely do our best to respond as quickly as we can. Thanks for your patience. Okay, Beth.
Great. So first question is, how do we get signatures on the documents when the meeting is done over Zoom?
Great question.
Okay. So if we're able to send email attachments electronically, that would be one means of getting signatures. If we can't get signatures that way, we may have to resort to U.S. mail, and the district or school may need to send a certified return receipt letter with the documents for signature to the parent or guardian. We can include a postage paid envelope if needed. So that would be one way, a couple of ways that we could obtain signature.
Great solution, Winston. Our team and ODE at large is working on providing some specific guidance documents around providing telehealth and telemental health. We'll be covering a little bit of this next week during our presentation around suicide prevention, but just to know that this document is forthcoming and it will have much more detailed information on issues of confidentiality, consent, operating in the telemedicine, telehealth, telemental health environment. Beth or Marnie, did you want to add anything to Winston's response? Okay, Beth, next question.
No, I think it's all good.
Great. Next question is, how do we address students who have occupational therapy services within their 504 plan?
Winston?
Okay, so that was the piece where OCR was pretty specific in saying that was an accommodation that's likely to only be provided in a face-to-face setting. So for those students, that may be a circumstance where where the school or the district is not able to provide that service or accommodation until we return to the school environment, and we'd have to determine what compensatory services may be needed and appropriate for that student.
Thank you. Anything you want to add, Marnie?
No, that seems very clear.
Great, thank you. Beth?
Next question is regarding telemental health. Is ODE recommending any specific platforms?
That is a good question. That will be covered in detail in our guidance document that I mentioned that should be coming out soon. I think that that is a wonderful question, and I think that would probably require a longer answer. So unless anyone on the team can defer quickly, we are recommending platforms and procedures that follow PERPA guidelines, and if related to your discipline, also HIPAA guidelines, depending on the work that you're doing. There are a number of platforms out there that serve that purpose, but we will definitely provide considerably more detail on this question in this guidance document. I don't know if anyone wants to add anything to that.
No, that's great.
All right, Beth.
This is Beth. Just one thing else I'd like to add is just a reminder to go back to your ethical standards and practices around platform use and virtual communication, and just refer to your own professional standards for those. So next question is, when it states that online accessibility must happen for students on 504, does that mean that the district needs to provide internet if that is a barrier?
I would tend to say if that's the delivery surface method that the school district is using and the student doesn't have internet, I would say yes, the district should seriously consider providing internet access to the students or presenting an appropriate alternative that allows the students equal access compared to the students who are receiving services through through online education.
Yeah, and I'll add to that. So this has been a major consideration at ODE because, as you can imagine, there are a lot of students and families, and even in some cases, teachers and mental health professionals that either have very little access to broadband, don't have technology, computers, tablets, et cetera, to access. And so there have been two efforts along those lines. The first was a survey that was put out several weeks ago that we are now analyzing, and a report was just written. And this week, again, another survey was put out to districts to specifically assess where the gaps are and what the barriers are for people to receive access. I know that ODE is in conversation right now with a number of folks, including broadband providers, that will hopefully help to bridge some of these gaps. We know that some districts have ordered hotspots and are having limited success in getting the numbers of hotspots they wanted. So ODE is actively working with partners to address this issue, and I can't give you a timeline or promises, but I can say that we are definitely very engaged in this conversation and are doing our best to provide equal access as quickly as we possibly can. All right, Beth.
So do any of you have any specific accommodations for students who have untreated ADHD? And how would that then relate to the online distance learning?
Anyone?
Okay, so I will, so that's not a mental health question, apparently. Okay,
well,
so
it depends how you define it. So yeah.
This is true. Okay, so let me start with this piece. ADHD is a condition that under certain circumstances likely requires 504 accommodation. There's some guidance on the OCR website, and we provided that guidance throughout for our trainings really throughout the last 3 years or so that's specific to ADHD. as Grace and Beth mentioned, we're going to post the presentation and some of the guidance documents from OCR. I will also post the OCR guidance document on serving students with ADD or ADHD. If the students have untreated ADD or ADHD, those may be students that may need to undergo an evaluation for services. A challenge with that is sometimes many school districts have said we need to do a direct observation or a face-to-face evaluation of the student before determining whether or not we're going to write a plan and make the student eligible for ADHD. So remember what the existing guidance is saying. If we really believe that a face-to-face or direct observation is required, we're going to delay that evaluation until we return to school, but we're also going to provide compensatory services given the delay. The last thing that I could suggest right now is that we may not truly write a 504 plan for the student at this time if the team is requiring a face-to-face evaluation or direct observation, but we should be able to, the pre-referral team should be able to consider interventions that may support the student in a particular time that may be rolled over into a 504 plan when we're able to do a full evaluation.
I might just piggyback on that if that's okay. And what I think I'm reading between the lines is like specific, like you're looking for specific examples. First off, I think it's important if a student is undiagnosed, then that's an important aspect of what is the barrier. Is it actually ADHD? Could it be something else? What's the barrier to the diagnosis? If more information is sought. Secondly, in terms of developing a plan, is there whatever the behaviors are that lends you to believe that that might be the issue, is there substantial, you again, you have to get to the substantial impact to that to that student's access to their ability. But in thinking of like specific things you may want to try in terms of interventions, you may want to try giving assignments in smaller chunks. You may want to think about how a teacher might be able to engage that student in just like in step-by-step processes that allow that student to focus. And of course, we don't have a grade level or anything in this question, but you may think about like specific things that would help a student to focus on specific tasks if that's what your concern is.
And just adding to that, opportunities for breaks and for movement are some other ones. And then besides providing chunks, maybe providing either reducing the amount of homework or assignments that are due, and helping the schedule or help the student and the parent create a schedule at home that might work for the student that has those different things built in.
Yes, great advice, ladies. And also thinking about all of these behaviors in context, because, you know, children right now are often, well, pretty much universally working in their homes. And so, you know, that presents a unique set of challenges, and that when children are in the classroom, they're in a fairly bounded and contained environment. And now children are, you know, dealing with working and are trying to exist in a household where they're with their, you know, parents or caregivers, siblings, dog, cats, temptations to do other activities. So there's a very real possibility that behaviors that you may be seeing are occurring in context and may be escalated by the fact that we're asking kiddos to learn in environments that don't necessarily have bounded spaces where they can learn it in an ideal way. So I would always encourage, particularly if it's a child that does not have an existing or standing diagnosis in a school context, to be mindful of the fact that we're asking a lot of them, and it might just be reflected in their changes in behavior. So just to be mindful of that. Beth.
There is a question around, do the considerations need to be documented somewhere other than email?
Winston, you want to take that one?
Sure. So if we're talking about conditions that are specific to 504 and adjustments or alterations that we've made, I think we want to document by email to make sure that we have parental consent and commitment by the school provider of the service. We may also consider just printing that document and making it an addendum or an attachment to the 504 plan that's specific to say, this is an adjustment or an alteration that we're making during the time frame that the district is offering distance learning. That does a couple of things. It one gives us a record of what was done and what alteration we made. Second piece it does is it gives us something to look at when we return, again, when we're assessing compensatory services.
Other thoughts, anyone?
I would also just highlight that there is a lot of grace and flexibility given right now. If you're using every tool you possibly can in order to connect and communicate and provide support for students, you're on the right track. And also keeping in mind, what are the pieces around confidentiality that should or shouldn't go through email, and how do you and how can you use like mail for those types of things versus like the documentation that you need. But again, using your best professional judgment, thinking about who needs to know, using the resources you have to capture information and documentation.
Thanks. And just to be clear, none of the guidance that we're offering on any of these webinars or any of our documents is meant to supplant or override your existing best practices, as Beth said earlier. Professional guidance is guidelines, codes of ethics and conduct, scope of work, all of those rules apply. We're just needing now to learn to be nimble in terms of the application, but the best practices are still paramount. So Beth.
Marnie was just talking about grace and flexibility. And so one of the questions is that when the 504 reevaluation dates are coming up, is there the flexibility to move those dates until the fall when the school year opens back up?
Yes, I would believe that there's flexibility in postponing a reevaluation to the fall.
Another question that keeps coming up is what is meant by compensatory services?
So at least in 504 parlance, compensatory services would mean what accommodations or related services we would use to make up what could be a perceived or ideally actual deficit that was prevented from the formal plan accommodation not being provided as written.
Okay, thank you. Any additions, Marnie or Beth?
Yeah, so for example, if there was a perception that the accommodations weren't made and a student might get additional instruction in the summertime, that could be one example of what compensatory accommodations might look like.
Great example, thanks. Beth?
One of the questions is, do teachers need to be a part of a Zoom meeting with parent and student? And does everybody need to sign the 504 forms in this distance environment?
Ideally, wherever possible, we would want the full team to meet. Again, with flexibility, timeliness, and effectiveness in mind, if we're not able to assemble the entire team in a timely and effective manner, I think we would need whoever is the building coordinator or case manager, along with the individual that it's most likely the teacher who's actually providing the accommodation. That's the group that needs to meet with the parent and be in the meeting to make sure that there's understanding and we can respond to any parental concerns or questions regarding the alteration or delivery of the services.
And I also think procedurally, what I hear in the question is how important is it a wet signature that every single person sign the same piece of paper? And Winston, I want to clarify, if a teacher were to email, I agree with the accommodations discussed in this meeting, that would that be acceptable as documentation that there was agreement to put in a folder?
Yes.
Beth?
So if we have students on 504 for depression or anxiety or other mental health issues, what are our responsibilities? And the further comment was, I saw you mentioned telemental health services. So what would that look like from the 504 coordinator or those implementing the 504 plan?
I'm going to hand this one to you, Winston, for the start.
Gosh. So I think what that means for the 504 coordinator. So again, let's first start with depression and anxiety, because we have issues where those are standalone conditions, and we have issues where those are coexisting disorders of other conditions. So for example, it's very well documented that a student with ADHD may have depression and anxiety as coexisting disorders, and the anxiety is actually the prevalent issue that needs accommodation. An example might be if we were in a testing environment and the student with who's identified as having ADHD has severe issues with test anxiety. We would get, from the coordinator standpoint, we would at least begin with accommodations that might include extended time, being specific about a quiet place to study, providing the exam offering in chunks. Okay, so I think those are things that the coordinator can do. When we begin to look at specific mental health services for students with depression and anxiety, I think I want to defer to my colleagues on what they think would be suitable. I believe the coordinator's responsibility is to help facilitate what the mental health professionals available to the school or district would suggest.
Mm-hmm.
And I'll just add to that. So oftentimes in a small situation, while 504 is a general education issue and not always led by school counselors or other mental health professionals in the school counseling or in the school environment, oftentimes school counselors are. And so so separating out the telemental health and the 504 coordinator issue, I think is a clarity point, but some of the telemental health things, services, supports may be things such as regular check-in, and during those times where they're connecting with either a school psychologist or a school psych, or those are actually the same two things, excuse me, a school social worker, a school counselor might be check-in, might be talking about that anxiety or depression, might be talking about short-term solution focus, for those things that are able to be addressed in that short term prior to referring out for mental health services to an external agency. So thinking about the telemental health, it could be the support that you would typically give in a building, but you're doing that in a virtual environment.
Yeah, thanks. And I'm going to refer folks to the webinar that we offered on, I believe it was April the 1st. That is also going to be listed under resources in the resources tab on the website. We anticipate that there's probably, if it's already occurring, but we anticipate that this will probably continue, that we're going to see increasing rates in depression and anxiety and other challenges as students are trying to navigate all of the myriad things that COVID is meaning for their lives. And so part of this raises some, again, systemic questions that we don't have time to address here, but we're thinking very carefully about, given the amount of resources that many districts have, many schools have, particularly smaller schools and smaller districts, there may be challenges in dealing with an increasing number of students who need direct service. So we're going to, we have recommended that that districts and schools pair heavily with mental health providers in your communities. We anticipate that at this particular point in time, that folks in the schools focus on Tier 1 services, and for Tier 2, which are more direct supports, not specifically group therapy, but more direct interventions one-on-one, that there be a consideration for referring out to local mental health providers. And that would be particularly the case in districts where there are Tier 3 events, crisis events, that if there are more events than people to directly address them, that we're strongly recommending referrals out. We have guidance documents, again, in that area on the website. Again, it's the COVID-19 website under mental health and social supports, and there's a dedicated area. It will be available, I believe, tomorrow, that is specific to administrators, school counselors, and other mental health professionals, where in the resources tab, you will see the webinars, this one and others. But there are also specific guidance documents around, and again, we fully respect that many of you, most of you probably have very effective ways of doing things, so we're not intending to supplant what you're already doing very well, but we do have some suggestions about how to best allocate resources given the anticipated increase that we will see in things just like depression, anxiety, and as Winston pointed out, comorbid presentations of the two, because they're highly interrelated. Beth, did you want to add anything?
No, nothing to add. We have about 3 more minutes for questions.
Yes.
Okay. Next question is that can the team hold a meeting to discuss services we are unable to provide during distance learning if the parent or parents, guardians are not available? And then how do we document such efforts to get a hold of the parents?
No, so I think that's one place where the guidance was pretty explicit. If we hold the meeting through any sort of, through any methodology that's not in person, we can only hold that meeting if the parent or legal guardian consents. So if we do not have parental consent or guardian consent, we should postpone the meeting until a time that the parent can attend. That may be one of the circumstances where we delay that meeting until we return to school.
And Winston, could you point once again to that guidance document where that lives? So for those who missed that earlier, that you that they'll know exactly what you're referring to.
Sure. So that was in the initial, that was in the fact sheet document, specifically that addressed 504 team meetings, 504 evaluations, and 504 reevaluations. I think right there it's very explicitly stated that we can only hold meetings that are not in person if the parent or legal guardian consents.
That being said, Winston, I think also I would harken back to what you already said, was there's nothing preventing school personnel from providing accommodations to students in an intervention process to help support the student along the way, even if we can't get that formalized meeting.
Winston, just as a follow-up on that, would you please send me that doc, and we'll make sure that we have that uploaded in this area as well so people can refer to it directly?
Yes, absolutely, Grace. Thanks.
Thanks. Beth, I think we have time for one more.
Last question was just to clarify that if the phone would be an acceptable form of contact for the 504.
Absolutely. We've used existing phone contact during school sessions, so phone is very much appropriate.
All right, well, I want to thank all of you, those of you who joined us today, and much respect to you for your guidance and your leadership in your districts and your work, for your expertise, for your service to Oregon children and their families. We have great appreciation for the fact that you are out there on the front lines doing the heavy lifting, and our much gratitude to you. Just to circle back, this broadcast will be available on the COVID-19 website under mental health and social supports in the administrator, school counselor, and other mental health professionals area in a tab called resources. That's where you will be able to find the presentation as well as a video recording. We will also post the resources and links to documents that Winston referred to in that area so that you'll have quick and easy access to them. Hopefully make your life just a little bit easier. Again, thank you very much for your time. We really appreciate what you do. And next week, at this time, Thursday from 11 to 12, I will be joined by Jill Baker, who is the suicide prevention specialist at the Oregon Health Authority. And we will be discussing specifically suicide prevention, a number of different bits of information there. We'll be talking about prevention at large, risk factors, etc. Jill will be covering OHA guidance on how to do suicide risk assessments, or at least evaluations in the telehealth environment. That's really useful information. We'll be providing, again, some crisis resources to you, as well as some information and guidance about what to do if you find yourself in a crisis situation in this environment, how to best navigate that situation. So much appreciation to you. May you be well, and maybe we'll see you again in a week. Take care, and thank you.